Diabetic retinopathy is a silent disease. This causes a blurred vision. People can have black floaters floating around in the front of your view. You need to have your eye checkup urgently. Last stage of the disease, there can be a sudden loss of vision, or it could be even a worst case scenario, a retinal detachment. Hello everyone, welcome to Retina Connect. In our last video, we looked at what are the risk factors for diabetic retinopathy. So another common question that comes to our mind is, what are the symptoms and signs? How do I know if I have a diabetic retinopathy? This is common in people who have diabetes. So the unfortunate thing is that the early stages of diabetic retinopathy, there are no symptoms. People are absolutely fine. So it is in the late stages that they develop symptoms. So that's why it's called a silent disease. So diabetic retinopathy is a silent disease. So all the more reason that you should have a yearly eye examination with dilated pupil and retina examination. That clears your doubt whether you have a diabetic retinopathy. So first thing. Now, when do the symptoms start? So people with the early stage of the disease, it has two stages. Early stages is something called a non-proliferative stage, and late stage is called proliferative stage. So even in the early stage, that is non-proliferative stage, people can develop symptom when they develop a complication called macular edema, where the retina at the center of the retina called macula becomes swollen, because we know that in retinopathy, the small blood vessels are damaged and they become leaky, and the fluid accumulates in the center of the retina and it produces swelling of macula. This causes a blurred vision. So this is the most common symptoms when somebody having an early diabetic retinopathy develops a macular edema. So this is blurred vision. Now, as the stage progresses to the later stages of the disease, like proliferative diabetic retinopathy, wherein small new blood vessels grows on the retina, the nerve of the eye, and they are fragile, they start bleeding. So if it's a mild bleeding, people can have black floaters floating around in the front of your view. So that is an urgent, you need to have your eye checkup urgently. Earlier stage, I said you can have a yearly checkup. So this warrants for a early retinal examination. And at that stage, we may be able to arrest the disease with a laser or an injection. Now, in a last stage of the disease, there can be a sudden loss of vision. It could be because of the bleeding is dense enough, obscuring the complete vision. That is something called vitreous hemorrhage, where it bleeds into the eye. Or it could be even a worst case scenario, a retinal detachment. So these are the symptoms that people have. But fortunately, if you have a yearly eye screening for retinopathy, then we pick it up early and arrest it then and there. I'm more happy to see people seeking so that we know that we can preserve their vision. It's very important. Now, people ask, is there different types of retinopathy? Actually, there are no different types of retinopathy. It's only the stages of retinopathy. I already mentioned early stages and late stages. So early stage, we get the disease. Even if you have a macular edema with few treatments, we can restore the vision. But the treatment is not a one-time therapy, that requires few treatments and it stabilizes over maybe 6 months or so. So in a late stage, we might have to go for surgery or multiple injections and laser, pan-retinal photocoagulation. There are treatments where we can restore even in that late stage, where you have the late symptoms or even complete blindness, the vision can be restored with the newer technologies and surgical innovations. So I hope this helps, and thanks for your kind attention.